Researchers say more and more Canadian children with chronic illnesses are being treated with complementary medicines, such as vitamins, herbal, and homeopathic remedies. But it seems that many parents don't bother telling their doctors or pharmacists that they're using the alternative therapies along with traditional medications.
And the researchers say that can be a problem because in some cases, the two types of treatments don't go well together. At Stollery Children's Hospital in Edmonton, 71% of parents surveyed said they treated their kids with complementary medicine, and nearly 20% of the families surveyed said they didn't inform their physician or pharmacist.
We're joined today by Janet Jacks. She's the owner of Goodness Me, a chain of natural food stores in the greater Hamilton area. Next to her, Dr. Esther Konigsberg, a family physician and integrative medicine consultant. Doctor, how potentially dangerous is it if your child is taking a prescribed drug and you decide to pick out some herbal remedy or supplement with treatment and not inform your doctor of that?
Well, there's potential side effects and interactions with everything. So it is a really good idea to speak to a knowledgeable practitioner. Physicians are definitely people who know about medication. Sometimes we don't know as much about herbs and natural health products, but there's more and more databases for us as healthcare practitioners to be able to source these things out. So it's a really good idea. And, you know, studies do show that a lot of people don't think it's that important to tell their physician, and it is. But we're also starting to teach medical students that part of a history is to ask their patients if they are using these sorts of herbal treatments.
All right, Janet, your stores, the Goodness Me stores, and other stores like your stores say that they offer these natural and organic products. Now, how's a consumer know when they go into, say, a drugstore that it's natural organic versus being greenwashed?
Well, I think, first of all, we have to remember that the definition of alternative or complementary medicine is very wide, and it doesn't just include things that come in a bottle. It includes things like faith healing, so prayer. It includes things like massage therapy. It includes things like chiropractic treatment. And often I think we as visitors to our physicians don't think of those things as complementary medicine, and yet that was certainly included in the definition. And so, complementary medicine isn't always what it seems when we first hear the term. Also, a lot of things that we might use might be extensions of our food. They might be food supplements, things like having fish oil instead of eating fish. People traditionally ate a lot of fish and sometimes don't today, and so we think of that as our food rather than as a remedy. And so a lot of things that we might do might be extensions of that. But certainly, if my physician, who is quite open-minded, were to ask me what I was taking, I would not have a problem telling her. However, when I go in for an appointment, it's usually 5 to 10 minutes long. And first of all, I might not think of bringing up what I'm taking because it might not have anything to do with, say, I've gone in for my sore toe. I might not think that it's important to tell her I'm taking vitamin C. If she asked me, I wouldn't hesitate to say. But it just doesn't come up a lot of times.
All right, let me interrupt you there. Doctor, when you're talking with certain patients, might you have an idea that they would consider alternative therapies, even if they didn't speak to you in consultation and say, this isn't working for me, I heard this is better. I mean, back in the day, years ago, if someone said they were considering taking acupuncture, a lot of doctors might say, oh, no, because they maybe didn't know enough about it. It wasn't their standard of medicine. Do you engage your patients in discussions about what they're taking, or is it the patient's responsibility to say, I'm considering taking this, or I've been taking this, along with this other medication?
Well, I'm a little bit different from many of my colleagues because my practice largely incorporates both conventional medicine and complementary and alternative medicine. So a large part of what I do is in that realm. So I may not be your regular physician, but I do teach at McMaster University at the medical school level, and it is our responsibility as physicians to be asking. We know by this study, but there's been many other studies that show that at least 73% of Canadians have used some form of complementary and alternative medicine in their lifetime. So I'm not surprised by the results of these studies at all. So to answer that, sure, it's good for the population, the consumers, to be aware, but as healthcare providers, as good physicians, we need to be asking that and incorporating that into a regular appointment where it is appropriate. And the other thing that the study also suggested is that we approach our patients in a very open way so that they do not feel that they would be judged upon in a negative way at all, so that they feel comfortable bringing this up.
Janet, your stores sell natural foods and remedies. Do you ever refer a customer to their physician if you feel like you don't have something that they really need, or you realize that perhaps your product's not going to do the trick for them?
Absolutely. It's our goal to help people find the information and the people and the resources they need, and we absolutely would recommend they get a diagnosis from their physician. We absolutely would recommend other kinds of practitioners as well, such as a naturopath that might be able to offer another viewpoint, or someone like Dr. Konigsberg here, who is an integrative medicine practitioner. So she's both a physician and one who understands more about complementary medicine than an average physician would.
Right. Doctor, we have about 30 seconds left. I want to ask you, I was in a situation once where it's rather than tell my doctor what else I was doing, I felt as if my doctor might feel as if I was going behind his back, going to a naturopath and getting something done that maybe he didn't recommend, or he wanted me to do something differently. Might that be a problem with your patients, where they don't want to tell you everything because they don't want to hurt your feelings that they're going to another doctor?
Again, I work alongside with these sorts of practitioners, so for myself, it's not a problem for my patient.
But for other doctors, might it be?
We're trying to break down those silos, and we're doing that at McMaster Medical School, and hopefully that will continue to grow, because really the whole point is we want to help our patients, and we want to work collaboratively with other practitioners as well.
Excellent. Wish all doctors felt the same way. Dr. Esther Konigsberg and Janet Jacks, thank you both for joining us today. We really appreciate your expertise.
Thank you.
Thank you.